Well, I'd like to welcome you, everybody, here to the program called Stress in the Healthcare Worker. And I assume that many of you, or most of you in the audience, are healthcare providers or nurses, doctors, uh, and even providers of clinical care, therapists. Um, I'm a psychologist here at Whittier Rehabilitation Hospital, and I've been here a number of years and have done these presentations with great interest. So with May being the Stress Awareness Month, I'm happy to have the opportunity to do this. And I want to thank Joanne Swiderski for pulling this all together. We're always 5 minutes late. And I also want to thank Dr. Jay Trichetta, who's our medical director, and Rebecca Roman, who's our administrator, for supporting these presentations, both in person and via the Zoom audience. So I'm pleased to be able to welcome everybody to this program that Whittier has sponsored. So what we're going to do today is spend some time first acknowledging that we don't have any real support for this program. We don't have any problems with being paid by others. I have no disclosures to make. The Whittier Health Network has taken no and has no disclosures to make on this, has taken no money from others. And we're happy to be doing this. A couple of things I'd like to just start by as a way of going forward is that stress really, as we think about it, here are the goals for today. You have to ask yourself, do you find yourself going into work with irritability and dragging yourself in? Have you been cynical or critical of your work and your coworkers? And are you consistently using food or alcohol to help you feel better about the things that you're doing in your work environment? So those are three questions that I always ask. Do you drag yourself in? Do you feel cynical and critical towards the supervisors or your coworkers? And do you often use drugs, alcohol, or other kinds of maladaptive responses to deal with the stresses of work? So that's a good question, and it's one that we want to kind of look at here a little bit more. So the important thing for us today is just to be aware that stress is everywhere. Stress is part of life and a part of our chosen profession. I want people to understand that and to begin to think about how they might start dealing with stress. And I'm going to give you some techniques, and we're going to go through them and give you some ideas about the best methodology to mindfully enter a stressful situation. Take a few deep breaths, and I'll provide you some literature on this, and try to quiet your body as quickly as you can. And that's very critical to adapting to the stress we encounter. So we want to use stress and understand it and its human impact. The body has a unique ability to adapt and respond to stress, and it's very often adaptive in people who exercise, people who share their experience with others, people who walk and take breaks during their work shift. Their bodies adapt to and respond to the stress. And there's a neurobiology underpinning of stress that we're going to go into. I want you to know about caregiver fatigue and burnout, which is a big problem in medical care and in the frontline EMS, police, fire service, nursing, medical fields. And I want to introduce some of these mindful, proactive responses to help build resilience going forward, because resilience and people who are resilient can undergo highly stressful events and get knocked down and then get back up again and get back into the fight. Okay, so we're talking figuratively now, but it's so important. The accountability for stress is so important in preventing human assets to become harmed and losing our human assets. And the whole point of this, and people that might be watching, I really want to emphasize that all we are is a human service corporation, human service business. We are in the business of helping people get better from whatever their affliction is. Here at Whittier, you might work in a school setting, or maybe you work in a medical center setting, or surgical center, emergency department. Maybe you're in a member of the clergy. We have some clergy people that have signed up for this, and that can have its stressful time. And so when you know and you've done this job, we realize how important it is to provide for our people that work with us. So, and I take a very strong stand on this, that the human assets we have are the most important thing that this hospital has to offer. Because without the human assets, the nurses, the therapists, the housekeepers, the cook and chefs and cafeteria workers, the administrators, the people who do the temperature taking and the greeters in our front lobby. Without all those people, we would be nothing, and we would have no service to provide. So our human assets, and that, by and large, that is the most important thing when you think about stress. It's about taking care of the people that you're working with and working for. So, and I meant to say at the beginning, this program is really designed to be interactive. Now, you tell me how to put your questions in, or to raise your hand. There are ways that you can go into the, along the base of the Zoom platform and ask a question, or unmute yourself and do so, please, because I really want there to be some exchange of dialogue. So we know that healthcare is a high stress career. Where does all this start? With the smiley face, or with your first EKG that you need to look at that looks like it's a wide PR interval there? So, and what does all this mean? Well, sooner or later, as you get into your chosen career, and we know that people enter nursing for a variety of reasons. People enter the healthcare provider service, whether it's psychology or clinical psychology or neuropsychology or social service, social work, nursing, therapy. We want to do something to make a difference in somebody's life. And so, people, start their careers. They start here at Whittier as a new employee or a new therapist, or maybe some of them are coming for training and having a pre-licensure training experience, and they come with all the enthusiasm of a highly trained racehorse. They want to hit the ground running, and they really want to experience everything. And there's nothing we can do to dissuade them from starting their careers. And often they're filled with piss and vinegar. And so in psychology, they believe that the younger student therapist, the younger psychologist, the younger psychiatrist, they do better with the more seriously mentally ill, because a lot of the mid-career guys have this belief that there's nothing that they can do to help people with schizophrenia, to join with them, to help them feel connected and make an empathic rapport. And so we know, and if with the right empathy and with the right expression of interest and the clinical acumen, you can make an impact with people that have schizophrenia, bipolar disorder, any of the real major mental illnesses that are often difficult and standoffish in terms of the therapeutic bond that is needed. And that goes for the same for someone working in a clinical setting with them as a nurse, or as a physical therapist, or some other kind of therapist. It makes sense also with pastoral care and chaplaincy in hospital settings. The wide range of patients you need to see is enormous. And I will I'm very interested in the chaplaincy, and I will talk about that in a little bit. So again, when I was a paramedic and they released me into an ambulance, I was so filled with excitement and wanting to do the different tasks that I had learned. And yet it came out with a lot of anxiety in getting your first calls, and we can talk about that. But nevertheless, we want to protect new employees, and I did some police training. We want to protect the new officers on the job as well, and it's because of the incidence of high lethality, high acuity, stress-related phenomena. High lethality, lots of potentially lethal calls, like code blues, like people coming in with respiratory failure where you need to quickly open an airway, people who are choking, people who are bleeding. Those are all high lethality, high likelihood or high possibility of death, and high acuity. People come in that are very, very sick, and you've got to do a lot of things in a quick amount of time to help that person get back to spontaneous circulation or to be recovered. So those people that are very excited and enthusiastic to learn new tasks should be supported, especially when they have the first acute, high lethality, high acuity event. So the healthcare worker experience, stress, it's important to know and that stress is avoidable. It's everywhere, but it's avoidable if we think of a few basic accountability facts. And the accountability is going to come up over and over again. Stress accountability. We have to all be accountable for the stress we encounter. Accountability, it's a new buzzword. First, we need to be aware of the stress that our bodies experience, that the job is a stressful one. The job, because of its shift work, it's very often you stay after your shift and are required to work extra time. The body's response to that with fatigue and high levels of tension and fear. You want to consider in the stress model your exposure risk. You accept a job in maybe in an urban area, you're more apt to be exposed to the high lethality calls, gunshot wounds, stabbings, overdoses, high lethality calls. Whereas you'll have those in other places, more rural centers, but they may not be as frequent, and they may not be as acute. So be aware of your exposure risk when you are entering a stressful situation. And we're going to go into that a little bit more as we talk about the neurobiology of stress. And interesting, this presentation was initially written for the healthcare worker, but it works very well with the police officer and the law enforcement. We've done this with law enforcement agencies. I did it for the Worcester Police Department last year, just before the coronavirus kind of wiped everything out. And mitigation, what are the things you can do to mitigate the symptoms that you might be feeling? Accountability, it encompasses all of these. So, we have all these newly minted nurses and psychologists and physicians that come on July 1st, and we really want them to have a good experience. Now, but experiencing critical incidents, okay, we're going to reframe the high lethality, high acuity calls are critical incidents. They can result in a significant and lasting effect on the frontline person, on whomever is charged to take care of that person. And when it's your first time, you need hands-on help going through it. The personal situations are often amplified by the employee's need to project a level of mental and physical toughness. And so one of the things we observe with new clinicians, and people who are new to the hospital, who may have had wonderful experience, but they're new to our hospital, is they're often feeling somewhat marginalized and isolated. And so it's incumbent upon supervisors and other peers to support them, to bring them into the group, and to really provide them with what they need to get used to being a member of this shift or this team here. Otherwise, we run the risk of having stigma, and stigma in mental health and stigma in stress-related syndromes is really the projection or expectation of weakness. So if somebody comes forward and says, that was really upsetting to me, and I am really, horrified by what we had to do in that last call or during the course of that last code, and I need to talk about it. And the supervisor says, well, this is the way it is, suck it up. We don't have time to do it. There's somebody else coming in the door. Now, how would that make you feel? It's going to make that person that came forward feel very weak and embarrassed, and perhaps more likely to keep the next time he's feeling that way or she's feeling that way to him or herself. So we don't want that projection of toughness. If the person is having struggles in certain protocols, then we want to support that person that's needing help. It's best for the team, it's best for that person, it's best for the patient care, and it's best for the family members as well. So, for career longevity, career hardiness, and resilience. And resilience is a buzzword. Everybody's talking about employee resilience. It requires a great deal of support, at least initially on. Now, people bring to these jobs a sense of resilience. And I wanted to people choose mental health, they choose medical care, nursing, they choose those things for a variety of reasons. And in order to have a long career, you've got to have the ability to reach out to supervisors, reach up to the chain of command and to your peers, and get that accountability support for relief of stress. So here, when we talk about stress, there are three issues at work here. First, the volume of work. Okay, so and I'll explain this stress performance sweet spot. This was done by David Posen, as a Canadian guy in Ontario, a physician who deals with stress. I think he's a psychiatrist, I'm not sure, but I've got a couple of his papers, and he's got a bunch of YouTubes if you really want to learn a little bit about his work. David Posen, Posen, MD. But he's come up with something like this. I think this other group have modified it somewhat, but this is a very interesting diagram. So say we start here. There's the x-axis and the y-axis and the x-axis, and there's a good area where there's an optimal amount of stress, an optimal level of performance, and the two intersect and they make this blue box. So if this is our stress line, if we're bored, there's going to be low stress and there's going to be low performance. Really, we're not doing anything. And boredom kicks in. Often with that, you find yourself perhaps a minute short when something big does come in the door, or when some situation occurs that you need to react to and be thinking about. So if one is bored, their level of arousal is low, and they're not ready for the stressful encounter. So we want to keep people from getting bored. So challenges come along, and we have challenges each day in everything that we do. And in neuropsychology, the challenges tend to be the assessments that I do and the scoring that we do of those, and the writing we do of the reports, and then reporting those findings to the physicians, and then reporting the families' findings to the families, and so forth. We also have emergencies that occur, and so you have to be at least somewhat ready for things like that. And so the challenge is to find a mix between, or a good balance between boredom and this aware, wakeful, alert, ready to react sense of well-being. The sense is that this stress will help keep us challenged and keep us focused, and to be able to do our job in this zone of optimal performance. So as you might expect, if the stress goes up along this axis, stress is increasing. Once we get to a point where this dotted line is challenge, and we start to have fatigue. This is called the sweet spot here, right in this area there. And that means that we're both active, alert, busy, and doing our best in all the protocols and tasks that we do each night or day. And when we go beyond that, the possibility of fatigue, of exhaustion, of illness, physical illness, of breakdown. And breakdown refers to the stress-related illness and all that goes along with it, a variety of autoimmune dysfunction and so forth that really can take over after the stress has gone on for so long. So this stress level is high. It does not ever go back down to zero. So we may go from coming into work at a challenge level, and then by halfway through the shift, you've got all this stuff to do, and you're in the exhaustion stage. And what happens then is the quality of our work tends to get worse. And it just begins to become more demanding, and our efficiency drops, our interest level drops, and our fatigue level increases. So remember, the three issues with the stress is the volume of work. Again, this is what we're just talking about. The velocity or pace with which you have to work. And that's very important to manage. Our electronic technology helps us work faster, but not necessarily better. So, and then finally, abuse in the workplace, where there's intimidation, where there's professional jealousy. It's not uncommon that these things occur, and so we really need to address that. And so very often within one shift, if there's 7-8 nurses and nurses' aides, there can be some camaraderie among half of them, and then others are left out. Very often we might have someone here that's a per diem nurse that works only once in a while, or even a locum tenens, a physician or a nurse that comes from another part of the country to fill in for a period of time when someone we know is going to be out. So that those kinds of things break or intrude upon the group process that goes on among people who work, close colleagues who work together. And so when that happens, it's often some tension that can be there, and that adds to the stress. Again, abuse, intimidation, bullying in the workplace, and professional jealousy. Now, this all flies under the radar, but we know it's there, and we know it goes on. So past a certain level, this certainly productivity drops off, and precipitously, and past a certain level of hours per week. They think 40 hours is probably the best amount of time to work full time. 40 to 45 is okay, but much more than 45 up to 50 hours a week, and it becomes a little bit more, and you're not getting as much efficient productivity as you need or as you'd expect for someone working 5 extra hours or 10 extra hours. So stress is good, it's not bad, but it does help us rise to the challenge of whatever it might be. Now let's put ourselves, let's use an example. Somebody comes in the door that has bleeding and needs fluids, and you need fluids quickly. And so if you've ever tried to get an IV into someone's arm, that either is shaking from being cold or hypothermic or having had a seizure or during a seizure, or just combative and not wanting to be there and push you away, even children. It's very, very stressful having to restrain somebody, hold somebody down, get the help you need so that you can insert your IV and get it properly working. The next thing is, or example might be intubation. If you're in an emergency room, someone's respiratory drive stops, you need to assess that. You need a bag valve mask and try to breathe for them. You might need to intubate, and that's another issue that's very stressful. It's a high skill that you need to have that you very infrequently use, and so it's a high lethality or high acuity, both, and you've got to be able to get that tube placed correctly. And so that's a stressful experience too. And if you're doing it in the back of a truck, it's even more so. So again, there's good, bad, and different stress. And I really want to emphasize that you can't keep drawing on your body's reserves while you're working without allowing it to recharge at some point. So you can't keep demanding of yourself to work extra overtime and things like that. And I see this in the state police who work 80 hours a week or 90 hours a week. That's largely impossible and to be effective. And having worked doubles before, or 16-hour shifts in the ambulance and doubles on the police force, it's very, very stressful. And if you and your skill set at the end of 15 hours to put handcuffs on somebody or to put an IV in, your skill set and your efficiency is much lower than it was in your first 8 hours. So we have to be aware of that. And so you must have times where you're not being called upon to do high stress, high skill types of protocols. So this being Stress Awareness Month, or May is Stress Awareness Month, a lot of this is becoming mandated as part of in-service training. Why? Because we know what the impact that stress has on human capital. And remember, I said our human capital, the human beings that we have on our staff, need to be nurtured and need to be taken care of and need to be supported. They don't need to be babied or coddled. They need to be respected and supported. And so what happens when people leave, and I wanted to mention that we now have a high rate of people leaving the medical field. Doctors going into research, doctors leaving the field altogether, nurses going to other facilities, nurses going to nursing homes and staying out of the acute care setting, nurses going into teaching or into school nursing, whatever it is. The hospitals are losing nurses and doctors and therapists very often to competitors and very often to home care to accommodate their own personal schedules. So we need to be aware of that. And I feel like, and I believe strongly, that we need to do what we can to keep those and retain those people, whether or not they feel stressed here or want to go to a different place that allows them to do more things, and maybe they're bored here and they don't get enough of the kinds of work they want to do. So it's all about that and meeting their needs. So again, we already went over this. The best productivity is found in workers that have a 40 to 45 hour work week. And much beyond that, productivity drops. And we also have learned, based on this, that a balance in work, family, it really needs to be found. And that often conflicts with the demands of a high pressure job, especially if you're a supervisor or working in a high acuity unit. And we have a couple of them here. So neurobiology of stress comes as a result of repeated high acuity, high lethality incidents. The neurobiology is understood because PTSD has been studied, has been well studied, and even mapped in the human brain. The effects of PTSD are linked to very primal, primitive brain circuits that play a role in the fear conditioning and the evocation of fear. When something evokes our fear, the lower centers of our brain, the amygdala, the limbic system, are all activated. And so this is an interaction between limbic system and the emotional processing of a task, and the ability to become very, very fluid with that, the ability to feel comfortable doing those tasks that results in extinction for the fear. Whereas a second time, a third time, a fourth time you do a procedure, it's not quite as nerve-wracking, or it doesn't leave as much a trauma on you as it might. And then finally, you begin to habituate those feelings over time so that it no longer becomes a perceived threat. Now, those people that don't, or have abnormal stress responses from their work, often feel that threat everywhere they go. They feel a kind of a sudden jolt of fear, of threat, of angst about something that they may have forgotten at work, or something that may be in front of them that they're seeing, and that they're never able to really habituate those fear impulses and those fear images without some therapy. And that's sort of what we do here. So here's an example. In healthcare, we build on experience. So we kind of do the same things over and over again. Now, depending on those three things: the volume of work, how many times you've got to do those stressful tasks that require extra skill, how quickly they come, how fast-paced they are. If you've ever been to a mass casualty experience, you realize what we're talking about. We used to do that here at Whittier. We would set up and have these drills. It's disaster drills, and the fire department would come, and we've had an explosion in the kitchen. They turned all the tables over in the cafe, and we had staff members that were injured, and we had to triage and assess each of those folks, and that became very, very interesting. And so, but it is stressful. We try to do that annually, and in doing so, you begin to understand and begin to habituate, and that fear does become extinct. So again, memories are built. If you see this is a model where here's a guy that sees this rattlesnake, but I put insert fear here. So whatever your fear might be, thunderstorms, maybe putting an IV in, or a central line, or doing CPR. And so that's the fear response. That's gonna be there. Now this guy is out hiking. You see him there, and his eyes are catching this rattlesnake there. So he goes, oh, he jumps back, and his heart is pounding, and he's breathing hard, and his muscles are all tense because he feels like he may have to run for his life or fight. And so this is what happens. Our bodies are processing our environments all the time, often in an absence of awareness. Now, I bring this example up all the time, that people, The Gift of Fear. A Gift of Fear was written by Gavin de Becker, and in 1996 or 1998. And The Gift of Fear it talks about the subliminal awareness of danger when you're in the presence of someone that wants to do you harm, or someone that intends to take advantage of you, or rob you, or kill you, or rape you. And that he did a study with people who have been victimized, and a high degree of reliability was found in those victims who had a sense that this was going to happen, that they saw something in the fear itself, and they saw something in this object that made them frightened. And it was maybe in this case he was looking at dating, and the women had a date, and the date was being overly familiar, say, can I come up and have some dessert or whatever it is? And she said, no, not tonight. And he pushed his way in, and then was assaulted. And that these fear responses were subliminal, and they felt them, but they didn't act on them. And so when we feel those fear responses, we need to act on them. We need to be aware of them, and we need to be aware of how they affect us, and how they elevate our level of autonomic arousal in the fight-flight mechanism. So what happens is we see a snake in the woods, or we see somebody that we don't quite trust, that's kind of making us feel mistrustful, then bang, we've got to step back and do something about that. So the example of that was important, I think, because to say that we're monitoring fear for fear response. If you hear a rumble of thunder off in the distance, you can begin to feel a little nervous. And then the thunder gets closer, and then you get the alarm on your phone that there's a medical or a weather alert. And so the stress becomes real, and you start to feel it. And so there's a variety of those ways, and you want to be mindful of the things that bring your own stress up a notch or two or three. And that may be when things get, the velocity of the work is going faster and faster, you're needing to move from one room to the other very quickly, or a lot of things are coming due, the medications you hand out, or the procedures you do, or the dressings you change, or the rounds that you need to make in your practice, whatever it is, it's coming faster and faster, it's increasing, and then suddenly the volume, they add a patient or two or three, or you're working in an emergency department and 4 people come in at once. One of them's a child who's crying. You can feel the stress go up in the emergency departments when this happens. And this is one reason why people wait. They wait, and emergency departments do a good job at helping their staff not be overridden by the intensity of the patients that are there, and their families. And very often the families are shouting for help, and they want something done for a loved one, and it just isn't happening and quick enough. And so they're on the nurse is on the doctor and the labs and so forth. Again, you can't keep drawing on your body if you don't give it a chance to rest, if you don't give it a chance to recharge. And how do we do that? We take breaks. And some of the literature that I've read recently is that you take breaks every 2 hours for 5 to 10 minutes, where you walk around outside. I was talking to a friend of mine that was signing on tonight, and he said, just take a long walk before you begin to present. And I said, yeah, that's a good idea. Yeah, I can do that. So we as frontline workers, we do a lot of handling of different procedures, different tasks, and it's often very stressful, and it's often in real time, which means we just have to do it quickly and get it over with. So exposure to traumatic scenes, if you've ever been out in the field, and sometimes hospital staffs will send physicians out in the helicopter, or there'll be nurses in the helicopter, and because they need extra bodies on the ground. I know at the Newtown, Connecticut school shooting, they had several big mass casualty ambulances that were rolled on the scene at that once that scene was cleared, and that handled a lot of that. So and when you go out into a scene like that, you'll never forget it. Nobody walks away from a mass casualty incident without having big chink in his armor, the veneer of his professionalism. It just does take it away. So gradually, over time, now we're talking about wanting to have people experience a good, healthy response and a resilient, positive career. And how do we do that? By dealing with stressful events and not allowing them to activate our hypothalamus, pituitary, adrenal, HPA axis in the brain and body. And you know the HPA axis, and I think we've already gone by it or it's coming up, is are the three organs that play the role in the fight-flight mechanism, that fight-flight response. So, and this happens all the time. People get caught up with the fight-flight, they get mixed up with all that it does and how it affects people. It is very, very problematic at times that their activation is always activated, is always elevated. You've probably worked with people who are always uptight on the job and always afraid that something's going to happen or that somebody's going to do something wrong or something's going to walk in the door that they're not expecting or that nobody wants, or that someone is going to give them an extra patient, or that one nurse will go out sick. So when anything happens like that and people are stressed, they already come to work with a higher level of HPA arousal, that that kind of tense, irritable, sometimes even cross towards the patients and their families. But so before that happens, we need to have some awareness of where we are, some self insight. Sometimes we have these groups and we do these presentations where their entire day. And in doing that, we can take time to talk about what you do for stress management. So it's the HPA axis. It's the axes that transmit cortisol and adrenaline in the body. It directly affects the heart and cardiac function, directly affects the respiratory drive, and it directly acts on the brain. So the brain is recording whatever incidents, whatever traumas might be going on at that point, and that's what hooks. That's what hooks in the acute stress reaction, and that's what lingers. Its hook lingers in a post-traumatic stress situation. Chronic stress has a strongly negative impact on public health. It's now considered the 6th leading cause of death. It affects not only physical functioning, it affects cognitive functioning, it affects psychological functioning, and autoimmune functioning, and autoimmune conditions like hypertension, like cardiac disease, like inflammatory inflammatory bowel IBS, pain syndromes are problematic as a result of stress, and it really does wreak havoc on all of us if we allow it to. So you adapt to stress. The stress we cannot eliminate unless we work in a medical office in Beverly Hills, perhaps, or one of the schools in the kindergarten, being the school nurse at something like that. But even that has its stressors, believe me. And I've talked to enough school nurses with the concussion program we do that really feel the stress, during the day. And in high schools now, the nurses' stations are like small emergency departments. So autoimmune functions respond over time with inflammation and even rheumatoid conditions can be affected. Irritable bowel, fibromyalgia, pain syndromes, depression. So if we exceed the sweet spot, if we go up in the level of stress, high arousal, high stress demand, then it exceeds our capabilities of coping. And really, that's the definition of burnout. And I'll give you that in a minute, is when the situation exceeds the resources that are on hand. Does that make sense? When a situation we're facing perhaps the Ukrainians now. The situation, the force coming at you is exceeding what you have resources involved. This is why they keep asking for our help. It's because they're starting to get overwhelmed by the opponent. The fight response tends to become overreactive following a career of unpredictable exposure. That's the key, is the unpredictability of exposure to trauma. You don't know when somebody's going to come in that's physical and violent. You don't know when somebody's going to come in that may need blood. You don't know when somebody's going to come in that might need an orthopedic procedure, who's dislocated a hip or broken an ankle. You don't know when a child is going to come in with something horrific. So what normal humans experience is beyond what stress allows. So stressful things exceed what we consider to be normal human experience. This is what that slide says. So we have to deal with it. We have to live with it and help ourselves to quiet our bodies down using some techniques and strategies. Often the healthcare worker has a lack of professional support, lack of manpower. We now know that in some places, nurses are caring for more patients than they were and don't have the professional supervision they need. And that there's an excess demand on their service without time for processing cases. And the processing of cases, we talked about this when we did our presentation in the fall when the coronavirus was quite high. The psychological importance of processing cases, talking about cases, saying the patient's name, talking about what you did and what you did and what she did and what he did is important for bringing some closure and finding some resolution of the trauma and the traumatic experience that may have left. Something you don't see every day has enough hook to cause you an acute stress reaction and perhaps a real post-traumatic stress reaction. So again, the HP axis is part of the automatic threat response. And so what we do here at Whittier is we have biofeedback methods that we use. And those biofeedback tools help, one, to record the body's response to stress, and then to gradually try to train it down. We entrain both the cognitive functions, the EEG, and we entrain the other physiological functions to reduce levels of stress. And I'm very confident with people that have PTSD in getting that startle reaction. They may not have flashbacks, but the trauma is there, and everything that triggers that trauma, we can kind of work on and process. And it needs to be reprocessed in a situation where you're not threatened, where you're not necessarily at risk, and other people's lives are not at risk. So there is malignancy in a high stress career. So in no other profession do men and women treat one patient after another when there's little chance to refuel themselves in healthy ways. And so people, I'm here on Saturdays or Sundays. The day shift is ordering food. They're trying to get ready for the evening and the hours that come later, but they're ordering food and they're often not a healthy diet. So not casting any dispersions, but we in paramedic school, we really looked at the diet. We looked at the costs. We looked at the salaries that were being given and the expense of buying lunch every day at a fast food restaurant and the nutritional excess that you get in calories at fast food restaurants is not a good program for health, long-term health. So we need to deal with the stressors in a healthy way, in an adaptive way, rather than a maladaptive way. And stress is unavoidable. We can control only some things and not everything. And as it becomes chronic, it starts to raise our risk of physical traumas and physical problems and autoimmune disorders. Stress stretches our emotional muscles, sets the stage for growth and normal development. So stress is important in stretching emotional muscles. How many of you in your younger years may have used alcohol to help you get close with people or get to be that person you wanted to be? You needed some sort of crutch. Well, yes, development is stressful, and the stress is what we need to master in order to become integrated people and to have a full and a cohesive sense of ourselves going forward, becoming adolescents and more, and young adults. So remember the first day of work, or the first day of your graduate school, or your first day of elementary school. Lots and lots of stress. But it took a few days, and you began to know people, you began to get the support you needed, and you began to feel like everything was going to be okay. Some people are better at that than others. And I say that with a smile, because some kids can can make a change, start a new school without any trouble at all. And yet others, they need support. And the schools are very good at integrating and bringing people in and matching them up with peers and having mentors and things like that. So some of these things are important. If stress is unavoidable, you should have a stress mentor that you can go to and talk with about the stressful conditions or the stressful situation or what it was that you're dealing with. Okay, so now we've got this problem. We've got an overactive stress response. Well, what do we do about it? Okay, so I want to have people ask questions, if you would. I will say that one of the things to adapt to stress positively requires that you have some protocol that you're going to follow, that you're going to take breaks every 2 hours, that you're going to have work exercise on days when you're off, and that you're going to be with family and do things that are proactively stress busting and resilient. But if you are having an overactive stress response, and what I'm talking about is if you're experiencing in the environment things that cause you to become, that either remind you of events that you've experienced recently, like a code or like an operation or something that happened to you at work that was unexpected and traumatic and high lethality and high acuity, something that was genuinely unexpected. You need to begin to start thinking about some of that. And during the pandemic, we put up a list, and we shared it with the nurses around the unit: stress management and relaxation during coronavirus. One of the biggest things, and we'll get to it here in a minute, is to avoid burnout. And burnout is not a disease phenomena. It's a occupational description of being in a state where the demands of a task or job exceed the current capabilities or emotional reserves that have a carrying impact on patient load. So think about that. The patient load is such that what you're bringing or what the shift is bringing in response isn't enough to deal with the demand. So the supply of bodies, the supply of hands on deck, the supply of cruisers, if you will, ambulances, whatever it is, does not reach that optimal efficiency zone where we can work efficiently with the gear that we have and the protocols that we're following. That happens over and over and over. A lot of bitterness, embitterment, and anger towards authority, people up the chain of command, can occur very easily. So here's a nice picture photographed by me, and it's a cenote. And many of perhaps people in the audience have gone and seen these cenotes in the Yucatan in Mexico. But this was one that I just felt like was so picturesque, and that tree that looms above the opening, which is 40 feet above the water, just looked like the tree of life to me. And this whole thing looks like kind of like a waterfall into this beautiful water.
Attention all visitors on the east and west wing.
Self-care is the practice of taking an active role in protecting one's own well-being.
Once it is at 7:30, visiting hours are over. Thank you. Have a good night.
Thank you. Good night. Self-care is the practice of taking an active role in protecting one's own well-being. And that means taking vacations. And particularly during periods of stress, taking breaks, walking around outdoors, taking a few minutes to discuss a case when it's finished. But you certainly need to be able to come together as a group and diffuse. If you've had something that's very, very stressful, you've got to come together as a group before the end of the shift and just kind of talk that out a little bit. Now, I've done that for police agencies and had diffusing sessions within the same 8 hours after a fatal shooting or fatal accident. We did it when one of the police officers died, drowned a couple of years ago now. Burnout is a syndrome conceptualized resulting from the chronic workplace stress that has not been successfully managed. It's characterized by these 3 dimensions: feeling of energy depletion, exhaustion. I remember I asked at the beginning, you come to work already tired. Increased mental distance from one's own job, and feelings of negativism or cynicism related to the job, and reduced professional efficacy. So now remember this, here's that, the stress, the stress performance sweet spot. So if you're coming and you're tired, you're not going to have a lot of reserve at all to do your work efficiently and to be at your best. So you're already tired, you're already at risk of professional reduced efficiency, and we need to think about that and work towards ending that. What can you do? Let's kind of get going with this. You can evaluate your options. Do I quit? Do I move to another job, something less stressful? Do I get more training? Do I get the peer support? Can I try to find some value? We need to find some purpose in our work. As Viktor Frankl says, to find meaning in the work that we do, and to appreciate and get our sense of our personal narrative as a function of that meaning and that importance that we impart in that role that we have. Try to find value in your work. Find friends at work that you can be light and maybe share some gallows humor with, and so forth. Take time off. Don't work every day of the week. Set boundaries with some people and with patients. I had a student once that got to know the patients, and he would visit them on weekends, come in and visit them on his off time. He would send cards on their birthdays, and they loved him. He was a student here, learning to be a psychologist, but he didn't set boundaries, and I think he burned out. And then you take daily breaks if you can from your technology. And we've been here, I've been here since this morning, and it begins to, looks like people can hear. I didn't see any questions up there. Yeah, in the chat box, if you have questions, please do it. And then take a break from technology. Avoid maladaptive behaviors. It's very important, and I'll go a little faster. Maladaptive behaviors include smoking, drugging, drinking, going out and partying after work, staying up all night, not getting the sleep you need, not doing exercise when you might want to, and those kinds of things. Maladaptively. Find ways to establish adaptive coping strategies. And listen to your body. Take a minute to hear what your body might be saying. And the most, such as, you can do this, you can do this, you can do this. And you can use that as a mantra in going forward and getting yourself better prepared in the situations that you might feel frightened or scared or uncertain about. We teach biofeedback techniques like this that help people that have had this abnormal fight-flight response. You can do this, you can quiet your body down, you can put the brakes on things. And this is really what happens and what needs to be done, to put the brakes on things. The most basic thing that you need to know about this is breathing exercises. It takes longer to inhale I'm sorry, it takes longer to exhale than to inhale to calm your body. So by doing a quicker inhale, 3 seconds in, 4 seconds out, that's going to start to activate the parasympathetic system, and it'll allow you to calm yourself down. Your muscles will relax, your hands might warm up, your heart will slow down, your breathing will become more regular. When people are active and anxious and stressed and frightened, they breathe shallow, they breathe very quickly, they become hypoxic, their muscles tighten up, their hands get very cold, their noses get cold, they get headaches. It's very, very troubling. And over time, you're at risk for fibromyalgia, for IBS, bowel, gut-related problems, depression, and a host of other rheumatoid conditions and other autoimmune dysfunction. But here's a perfect definition. Resilience is defined as the capacity to integrate the breadth of our work, the broad scope of what we do, with healthy adaptive coping, optimism, mental flexibility, and a healthy resolution of traumatic events. And we have to do that as a group. As much as possible. I as a psychologist, I never single out a single person. Someone might be most upset by their patient passing away, but everyone is included in the stress debriefing. A few years ago, we had 2 codes in a row. One, we got out the door, and there was a second one, and the staff were very, very troubled by that. And I don't remember how they turned out. I think both of them didn't make it, but the team worked very, very hard on both and did an excellent job working towards resuscitation. And so it was very traumatic for people. We also had another gentleman who had a PE during his recovery from a gunshot wound, or several gunshot wounds. And he was getting better, and he was talking, he was with us, and suddenly he wasn't. And the staff were very, very overwhelmed, working hard to help him, and then to have him go south like that, it was very sad. So the thing to do is learn your triggers, learn what are the things that you can take care of and those that upset you or impact you. Put a name to your worries and be aware of when you need to step away, take a walk. Mindfulness, learn strategies like I've talked about a little bit that lower stress. Paced breathing. Just remember, paced breathing, guided imagery, yoga, physical exercise is always good, and the more the better. Again, so these are adaptive coping strategies rather than maladaptive ones, and avoid the stigma and shaming of saying, well, he's on a disability because he had a code, and we all have the same code and we're not out on disability. That's a shaming response, and that's a stigma. Putting stigma on someone that it's stigmatic to become affected by these things, okay? So I want you to think about tools for stress management, and these include reframing, making connections, reframing the incidents and your response to the incidents. Accept that change is part of living. Accept that you're not going to have control over everything. Move toward goals you set for yourself. And by goals, I mean, well, how do you want your career to turn out? What sorts of what sort of protocols, skill set do you want? What sort of career growth do you want to have? You want to start at a lower level and work towards supervisory level or advanced life support level, this ACLS, nursing accreditation for rehabilitation, critical care, so forth. Take decisive actions when in a situation that requires this decisiveness. Look for opportunities for self-discovery. And these are the classes, the things that you want to do, the talks, maybe like this one, the opportunities that you can think about your own situation in times that are stressful, and how have you reacted? How has it worked out for you? And nurture a positive view of yourself. keep a perspective. I always hear people when they come for stress-related things, their view of themselves is so negative. They have such a perfectionistic desire, and because they were beaten up at work and couldn't go back to the police force or couldn't go back to the jail, the work they did in a jail, or couldn't go back to the hospital for a while. They saw themselves as weak or stupid or something like that. Nurture a positive view of yourself. Keep perspective, be accurate, maintain a hopeful outlook. These are all resilience building tasks. Take care of yourself using exercise, using paced breathing, and avoid the negative self-appraisal. The APA has a lot on their website. The Mayo Clinic has a whole bunch of stuff that's on the website. I found a paper in JAMA, the Journal of American Medical Association, from 2018, the Association of Stress-Related Disorders with subsequent autoimmune disease. It's a very, very good paper. I think it's one of the penultimate papers on stress. It's in JAMA. It's called the Association of Stress-Related Disorders and Subsequent Autoimmune Disease by Song, SONGMD. I took a lot of the material from this. The study really involved patients from Stockholm and Sweden, but it was a very well-designed study in a country that kind of prides itself on its lack of stress. So these are some basic step-by-step things that you can do. Here's John Kabat-Zinn. He was at the University of Massachusetts and may still consult there, but the whole stress clinic at UMass Medical Center was initiated by John Kabat-Zinn. I've had a couple of presentations by him. His mantra is, you can't stop the waves, so why don't you learn how to swim? And you cannot ask yourself, your job here, you cannot ask a nurse, you cannot ask a doctor, you cannot ask a police officer to muddle in the water and not expect to get wet. And so we have to expect and support people who are doing these jobs that are stressful and stress-inducing and can cause long-term changes in your health without supporting them, without helping them get dry or stay dry, and teaching them to surf, perhaps. But it's very important that we as practitioners think not only of our patients, but of each other in a kind, empathic, and sensitive way, so that we can help lower the stress that people feel on the job and can go on and have long, resilient lives, and that our businesses then can thrive, that nurses are happy, staff members are happy, they're working efficiently and resiliently, and they're appropriate with their patients, and we're getting a good model of care. And that's what we want. We don't want to have openings where nurses are leaving to go to someplace else, whether it's less stressful or more stressful. And so we don't want to go where people are paying $10,000 sign-on bonuses. It's that hard to find people now. And so this is a result of stress and the stress in the system, and the stress result of the pandemic and all the other things that we've been talking about. Certainly the last 2 years have been stressful on everybody. So I want to thank you for being here with me. And if there are, I'm looking at the other screen here to see if there's any questions. There are. Can you share more interventions for stress reduction? Well, we can certainly go and talk about a couple that I had slides. I've got a couple of different programs here. Yes, if I take just a minute and do it. Mindfulness is a whole host of things that we do with John Kabat-Zinn as the leader. Breathing, increased breathing on the intake, slow on the exhale. I can't emphasize that enough. You don't need a lot of equipment. I've got all this biofeedback equipment, and you don't need it. If you have a second hand on your watch, or you have a clock on your wall that has second hand, 3 seconds in, 4 seconds out. That's going to put the brakes on your level of tension. And if you've got to practice it 3 or 4 times a day. Paced breathing, it reduces, it's shown, it's a fact, It reduces sympathetic arousal in the autonomic nervous system. And that's the whole stress response. Take time to be present. Okay, so to be present in the moment. If something happens, after something is done, said and done, take a moment to be present. And a lot of the folks that were in New York City, where the people were there for the coronavirus, they were admitted. Many died in the emergency department. After each one, they took a moment to be present. Now, some of them may have prayed, some of them may have just held hands, some of them may have just had a moment of calm, of quiet. But that moment is enough to help kind of bring some closure for that particular patient and to put it behind them and go on to the next one. So take time to be present, quiet your mind, allow your brain to refocus on the next task at hand. And that can be a minute or it can be longer. So what I tell the cops, before you all break off, go all in your separate ways again. If you're a motor vehicle crash, we had a terrible one in Worcester a couple of weeks ago where a man on a motorcycle hit a tree. Take a moment to be present. And there'll always be someone that will think that it's a time for prayer. It doesn't necessarily have to be a time for prayer. Exercise is key. I didn't emphasize that enough, but getting regular exercise, even if it's just walking, you got to increase your exercise 30 minutes, 40 minutes, 3 or 4 times a day or more. Okay. Avoid the overuse of alcohol. Unfortunately, at my house during the pandemic, the happy hour started earlier and earlier every day, and that could be a problem if it went on much longer. So avoid that. Alcohol is not a good adaptive response to stress. A healthy diet. I found that some people get relief by fasting. If you can do a week of fasting for 14 hours and then having a 10-hour eating window and then a 14-hour fast and doing it that way, and so you're burning more calories and your body really gets set up to feel good, and it does work. So you can do some reading on the fasting model of nutritional keep. Yeah, excessive screen time. We have electronic medical records now, and it's excessive. We're on them from morning till night. We don't even see each other's faces anymore, between the masks that we have to wear and between looking at laptops. Everybody walks around carrying laptops now. So reach out to your extended family. Don't be friends with just your nurse friends, your doctor friends, or your police friends, or your fire friends, or your priest friends. You have to have a good mix of healthy family members that you can go and reach out to. Avoid watching the news too much, about reading about the pandemic or about the Ukraine war or the Russians or the nuclear strike or whatever. Don't be afraid to ask for help. Don't be afraid to ask for help. I say that over and over again. There's no stigma in weakness, and there's no stigma attached to asking for help. And rely on your training. And if you feel like your training is absent, like setting a drip and having a drip 15 drips a minute, you've got to figure out the medical math and set that up. If you don't quite feel comfortable doing that, have it shown to you. Do some practice runs. Practice the skills that you want to get better at, and that will help. Okay, so there are 10 things that you can do for managing and relaxing in a stressful environment. And I know I've gone over, and if there's anybody that's still listening, I appreciate it. I enjoy these things, and I try to present an awful lot of information, and oftentimes there's too much information. But I do want to just emphasize it is highly important as healthcare providers to deal and manage stress in an adaptive way. The techniques are one thing. Your skill set, your education, your coordination with staff and mentors is important. until you feel comfortable and can let go of the fears that are associated with a code or with needing to do an IV in a high stress situation or whatever else. You put the task in there. You know, it's always tough, you know, in different jobs to have certain things that happen. You have to deal with them, and so you have to do them over and over again to have a good sense of motor memory and procedural memory, so that you can do it with your eyes closed or within a stressful context. So if you are that person at the beginning, I asked, do you drag yourself into work when you're tired and you feel bitter? Have you been cynical and critical at work towards the other workers, perhaps professionally jealous or angry? And do you have food and alcohol that you eat and drink when stressed out? If so, those are the first 3 signs of burnout. And so you want to kind of understand that and begin to work through that if you need to. And we can help you with that if you want to contact me. And I don't mean, get a therapy, have therapy, but we can just talk about it a little bit more. You can send me an email, and that can be it. So having a sense of achievement versus failure as an outcome, can stress make the difference? Yeah, if you have that's a very good point or question. So maybe having a sense of achievement versus failure as an outcome. Now, achievement meaning a save or completing the task, completing the putting in an IV or a catheter or something that requires some technique. Stress can certainly impact that, and we need to be calming our bodies. The Canadian RCMP, Royal Canadian Mounted Police, train their officers on this stress model that I gave you, that where you're working at breathing, paced breathing. They practice it during the 6 months of this training, and over the course of 6 months, they're practicing it every day. And so what they do is when there's a call out for an armed person, they do 30 seconds, or they on the way to the call, they're doing the deep breathing and slowing their bodies down. And during the 30 seconds before entry, they provide that same 30s. They stack up outside the door. They're ready to go into a room where there might be gunfire. And so they do this fast-paced breathing or paced breathing. They slow their breathing down. They do it very quickly for 30 seconds. And then they're in, and that helps them to calm, so that when they get in the room, they can take in all that's there. Otherwise, what happens is that with when you're at a gun call, your tunnel of vision, your field of vision narrows, and so all you're seeing is what's over your gun. You're not looking at people on both sides of the room that have guns trained at you. So you need to be able to enter a room and see the entire room, and the stress can kind of change that. And so the breathing allows them to go into a situation that sometimes evokes that narrowing of tunnel vision, high stress tunnel vision, and that can help. So the breathing does help, and that can help reframe situations and help our expertise, our skill set work better. You don't want to go into a room with your gun all over the place. You've got to look. You're looking for somebody. You're looking for a target, and he's here somewhere. And you got to look carefully, and the breathing helps you do that. So I really am appreciative of people having asked so many questions. And at an hour and a half, we did some extra interventions, a sense of achievement versus failure. Stress can make the failure more of an outcome than achievement. And sometimes when under stress, the sequence of events that need to take place may be lost. So practice makes perfect. You got to overlearn the sequence of events. And that therefore, when you're in the stress of being outside or being in an ambulance or something, and you have to do a procedure, the sequence of events have been practiced so many times that it's more automatic, and the stress can kind of flow away. So I've enjoyed this. I love having these kinds of opportunities. This technology isn't super familiar to me yet, but I like it. I hope that I come across as caring. I do want to be able to address some of the messages because these are important, and you people took your time to come and just sit for an hour and a half, and I appreciate that. And it's late at night, and most people want to be away from the home and back, away from work and work type things. But stress is important. We've all had it in the last 2 years, and I wish you well. I wish you all the best in dealing with this. And if there's anything I can do, please let me know, and I will happily work with you guys and try to help with the stress program in your place of work, or we could do it over the internet with Zoom meetings. Just consult that way if need be. If there's the bullying that's going on, professional peer jealousy, we can deal with that too. So anyway, thank you very much. I hope you all had a good time with this, and I will say good night, I guess. And
Thank
Joanne.
you.
Okay.
Thank you so much, Michael. It was excellent program. And everybody will be getting 1.55 contact hours for this as well. The eval tools will be going out on Monday, everyone. So if you want to keep an eye out for those, but absolutely wonderful program. Thank you very, very much.
All right. Yeah, you're very welcome, Joanne. Thank you for having me. And I'll say good night to people.
Good
Thank
night.
you.
Thank you.
Thank you so
very
much.
Thanks, everybody. Good night.
Thanks, Joanne.
Absolutely.
Bye-bye.
Bye.
Thank you, Joanne.
You're very welcome. Very welcome, everyone.
Good night.
Good night.
Good night.
Good night.